Vitamin D plays a crucial role in bone health, the immune system, and metabolism, but the debate over the right dosage remains controversial. While some experts see high doses as promising for treating autoimmune diseases, others warn of potential dangers. Uncontrolled or excessive intake can lead to serious health consequences, especially when taken over a long period without medical supervision. One of the biggest risks of high-dose vitamin D therapy is hypercalcemia, a dangerous excess of calcium in the blood. This imbalance can cause symptoms such as nausea, vomiting, fatigue, and constipation, and in severe cases, it may lead to kidney stones, kidney failure, or heart rhythm disorders. Experts emphasize that vitamin D should not be considered in isolation, as it significantly influences calcium absorption in the body. Without an adjusted diet and regular medical monitoring, high intake can result in serious side effects. A particularly controversial approach is the so-called Coimbra protocol, developed by Brazilian neurologist Dr. Cicero Coimbra. It relies on extremely high doses of vitamin D to treat autoimmune diseases like multiple sclerosis. While some patients report positive effects, scientific evidence remains largely insufficient. Experts such as Jaf Ziemsen from the Center for Clinical Neurosciences in Dresden explicitly warn against this method. Without strict monitoring, it could lead to severe damage, including kidney failure. The therapy requires a low-calcium diet, and even minor dietary mistakes could have dangerous consequences. Another issue with high-dose vitamin D therapy is the lack of personalized adjustment. Vitamin D requirements vary significantly from person to person, depending on factors such as skin type, sun exposure, and genetic predisposition. The European Food Safety Authority, EFSA, has set a maximum daily intake of 4,000 IU for adults as safe. Some experts argue that higher doses may be necessary, but without precise medical supervision, the risk of overdosing increases significantly. Older adults and individuals with certain pre-existing conditions may be particularly sensitive to high doses. Scientific data on the long-term effects of high-dose vitamin D remains limited. While there are indications of potential benefits, large-scale controlled studies confirming its safety and efficacy are lacking. Many experts caution against relying on anecdotal reports or unproven health claims. The human body is a complex system, and interfering with hormone regulation can have unpredictable consequences. Despite some positive individual reports, the uncontrolled use of high-dose vitamin D remains associated with significant risks. Anyone considering higher doses should do so only under medical supervision and with regular blood tests. Without proper monitoring, this type of therapy can do more harm than good and, in the worst cases, lead to serious health complications.